feet away, taking in every note and expressing their approval. We'll hear from Goodman, Ellington, Kenton, and several others as they perform on stage. Tune in, go swinging down the lane with David Miller.
Saturdays at 7 on KSJE Farmington.
Next time on Philosophy Talk, identity politics.
Slicing and dicing people by race, gender, religion. No wonder we're so divided.
Identity politics isn't the problem, Ken. It's the solution.
To what?
To a society that marginalizes some identities while valorizing others.
Why can't we all just get along?
Identity politics next time on Philosophy Talk.
We're one, but we're not the same. We get to carry each other.
Listen to Philosophy Talk today at noon on KSJE 90.9 FM, Farmington. This program is supported by San Juan Health Partners Urology, providing a wide range of personalized services for the whole family, including children. Our caring professionals are dedicated to helping meet your urology health needs with skill, experience, and service you need. For a complete listing of our services and to learn more, visit sanjuanhealthpartners.com or call 505-609-6300. San Juan Health Partners Urology, a division of San Juan Regional Medical Center. 10 minutes past 8 o'clock. Good morning, everyone. I'm Scott Michlin. Thank you for tuning in to KSJE 90.9 FM, the information and cultural beacon of the Four Corners, broadcasting from San Juan College. Special good morning also to our viewers who are watching us live this morning from our visual radio studio on the KSJE Facebook page and YouTube channel. Welcome aboard, everybody. It's good to have you along with us. Coming up in just a moment, our focus today is on CHIC, the Community Health Improvement Council here in San Juan County. We'll be talking about the new Transitional Rehabilitation Center here in Farmington from the Wellbrook Corporation. My guests are here from there, and we'll be talking with them in just a moment. Later on this hour, as we do on Tuesdays, we will check in with the Farmington Regional Animal Shelter, talking about some of the pets available for adoption this week. That is coming up this morning about 8:55. Stay tuned for that. Then at 9 a.m., Mick Hess will take over the airwaves. He will take us roving with the arts at 9 a.m. And today, Mick is playing more of the Haydn Symphonies. He is up to Haydn Symphony number 93. That is coming up this morning at 9 right here on KSJE. And, of course, you can always check out our programming schedule by going to our website. That's at ksje.com. It's also where you'll find our regional events calendar. Lots of events that are going on this week in early February. A couple of things to point out for you. As you can see on our screen right now, Enduring Traditions, Jane Whitmore Photography here at the Henderson Fine Arts Center Gallery at San Juan College. A Matter of Balance class happening at San Juan Regional. Chinese New Year celebration here in San Juan College happening today. It is the Chinese New Year today, by the way, everyone. So there's that to check out. Jordan World Circus is coming into town later on this week, and some other things we want to point out to you as well. The Art of Rodeo at the Farmington Public Library, and Pour and Explore, sounds like a wine event at the Farmington Museum, coming up later on this week. Just some of the things you'll find on our regional events calendar at ksje.com. If you have a nonprofit event and want to let folks know about it, we invite you to add your event to our calendar as well. Well, let me introduce my guests who are here with us this morning from Wellbrook, the Transitional Rehabilitation Center here in Farmington. The Executive Director is here. Ian Chartier is here. Good morning. Thank you for coming in this morning.
Good morning.
Thanks for coming in.
Thank you.
Also, Krista Ellis is here, Community Relations Director for Wellbrook. Good morning to you.
Good morning.
Thank you both for coming in this morning to talk about this new facility in Farmington and San Juan County. And when I say new, I mean brand new, because you haven't even opened yet, really, for patients or clients, that is, but or guests. But the building's open.
Yes.
That's what's happening. And so talk to me a little bit about what that means, what you're bringing to town, this transitional rehabilitation facility.
Well, transitional rehabilitation is a subacute center that will build people's strength, endurance, and balance, either after surgery or after an illness, so that they can transition safely into the next level of care or the appropriate level of care for that individual.
Right. And so the idea being they can get out of the hospital a little faster and into maybe a facility like yours in order to get them back home faster.
Absolutely. Absolutely. Through physical therapy, occupational therapy, speech therapy, and nursing services.
Those are the areas that
we will be providing.
Right?
Yes.
And Ian Chartier, let me talk to you a little bit about your position as executive director. You are no stranger to the area. We were talking before we came on the air this morning. You've worked in Southwest Colorado for a number of years, right?
Yeah, I was the administrator up at Four Corners Healthcare Center in Durango from 2003 to 2013. So I've been in the area for quite a while. Grew up on the western slope of Colorado. Always have really enjoyed this area, and after moving away for 5-6 years and being in the city, ready to get away from the city and back to the area I love. So
welcome back.
Thank you.
Is that right? So here you are. And so your facility is on the west side of town. We were talking a little bit about that as well this morning. The address is Nelson Avenue, and for folks who aren't familiar with where that is, we were talking it's down near kind of American Plaza, west side of town, near the hospital, kind of that area.
Our parking lot touches American Home.
Right.
And PMS.
There you go,
clinics.
Presbyterian
Yes.
Medical Services.
Yes.
And so if you're either on Pinion or Broadway, you can get to where you are.
Exactly.
That's what we're talking about. And it's a 50-bed facility, correct?
Correct. We have 50 suites, all private, with their own private bathrooms.
And so, but much of your treatment is designed for outpatient. Is that true or not true?
Primarily
What would you say?
inpatient.
Is it?
We will be looking at some outpatient. That would be mainly from a therapy perspective.
Okay.
So if someone that PTOT and speech therapy can get ongoing outpatient therapy, but primary focus will be on the inpatient side.
I see. And so right now, let us know. You've been hiring folks and getting ready to open. It's a brand new, from the ground up facility.
Yeah, really reviewing policies and procedures, all those things ground up. Right now we have about 30 employees, and so what our big focus right now is obviously onboarding them, making sure that they know what our systems are, even from doing, we're working on practice fire drills to making sure practice MedPass, and obviously with our certified nursing assistants, nursing is a lot of skills checks so that they know how to properly use all the equipment. All those things really become familiar with our community so that when we do have our guests in our facility that really it should be hopefully a seamless transition to actually providing care.
Right. And that should happen,
well,
give us an outline.
yeah, so probably the test guest, we're looking at starting that in end of February, beginning of March. And then basically what we kind of have to do there is that we come in, we have 3 to 4 test guests, and we take care for about a week, maybe 2, make sure that all of our systems is working properly. Then we reach out to the New Mexico Department of Health and let them know that we are ready for our certification inspection, and then from there it kind of depends on their availability and how quickly they're, but typically within the next couple of weeks they would come in and do their inspection. Once that occurs and everything goes as planned, then the test guests go back to wherever they were, and then we start fully admitting from hospital and different things like that and qualifying
Got
insurance.
it. So this spring, things are
Yeah,
happening.
so
busy time.
Yeah, late March, early April, and really start to going into summer full board.
Right. And these test guests that you talked about, we mentioned that earlier too before we came on the air. I was asking you a bit about those. These are actual patients, right?
Yep.
Actual folks who need your services, who are able to come in, and they're a little different situation though, because there's not, you're not filling up your facility with these folks just yet, but they're just tests to be able to check with your systems, I suppose.
Yeah, and it's actually it's a community service too as well. So these
Right.
are people that will not have to pay for anything while they're in our facility. When what we've done is we've reached out to different physicians within the community and try to paint a picture of, do you have some people that they don't have insurance, that they were able to get services normally through that, but but could use some therapy and just some care for, that they maybe didn't get at one point in their recovery that really may help them take the next step and be able to be more successful at home or in the community. So, in a sense, do a good thing too while through this whole process.
Right. And Krista, tell me a little bit about how that works too, because it is a community service, right? If you're providing this care
Absolutely.
to folks, right?
We have we've actually toured a few individuals. They just don't meet the qualifications for inpatient rehabilitation. So as we're going along and we're collecting the clinical information to make sure that we can meet the needs, we're really trying to target that type of individual that either through lack of a qualifying hospital stay or a lack of insurance, but really truly needs the services that we can provide. That's a good 2 weeks of 7-day-a-week therapy that those individuals will be able to get, as well as nursing care.
That sounds like a very specific type of client or patient or guest that you're looking for.
Yes, we're, if you need physical therapy, if you're slightly teetering at home or recently diagnosed with some arthritis in your knee and surgery is not something you want to jump right into, that's the type of individual that we can possibly help.
I see. And so it's not too, if folks are listening to us this morning and they think that sounds like them or a relative or neighbor, they could still reach out to you maybe to see
Absolutely.
if they do qualify for this opportunity, I suppose?
Absolutely.
Okay. What's the best way to do that?
They can contact me at the building.
Okay.
Or through my cell phone number. And I think my cell phone number is on...
That's the 505-675-4545?
That's the facility number,
Is
yes.
that a good, okay.
Yeah.
That will work as well.
We'll
yeah.
give that one then.
Yeah,
Let
that's
folks know.
fine.
And we'll repeat that too in a little bit, everybody. My guest this morning from Wellbrook. They are the operators of the new Wellbrook Transitional Rehabilitation. And is it a hospital, a center? I keep missing the word of what to call this facility. So help me with that word. What should I be calling it?
Post-acute.
Post-acute
Facility.
Yeah.
Correct.
Okay. That's the best term. So,
Yes.
and it's going to be opening this spring here in San Juan County. It's located in Farmington on the west side of town, as we mentioned, kind of in the American Plaza neighborhood, if you will, between Broadway and Pinion Streets. And facility is open. You've been giving out tours, you were telling me, right?
Absolutely.
So if there's probably some other events that folks can come and if they want to check it out, they can come and check it out.
We are usually in the building anywhere from 8 o'clock in the morning till about 5 o'clock in the afternoon. There's somebody there. Come in, take a look. I know there's a lot of curiosity about what the building is all about.
Right.
And truly you have to see the building to understand what we're going to do. It gives us, we're testing systems with nursing. We also need to test our customer service and our tours as well. So I encourage people to come down and take a look at the building. I know I get a lot of questions since I've moved to Farmington. Oh, what is that building going to be?
Right.
So if you've ever driven by and wondered, please stop by.
Check
We
it
would
out.
love it.
Okay. And talk to me a little bit about Wellbrook, because you are new to the community as well. Folks maybe aren't familiar. I know you have other facilities in the area and in the country, certainly. I think Grand Junction, there's some facilities there. And Ian, tell me a little bit about the company.
Well, it's a smaller company, and really it's kind of made up of people that have worked in the skilled nursing industry for many, many years, but for larger companies, and they saw an opportunity to do things a little bit different, to really kind of actually focus on certain communities that are maybe not necessarily what Albuquerque's or Denver, the larger markets, to focus on smaller markets like Farmington, as you mentioned, Grand Junction. We also have one in Flagstaff. Las Vegas was the first one, Las Vegas, Nevada. And so that's probably on the larger side, but and then also we have one in Las Cruces. So small to mid markets, and really that maybe a lot of bigger companies weren't focusing on. But they've also they allow us to have a lot of autonomy at the facility level, really to develop relationships and really be a part of the community. I think the other thing, even from setting up local vendors to provide services versus larger chains. So they really want to be a part of the community, and that was something that was very enticing to me when I made the decision to come on board with this company, and really excited because I think that's what I've really always enjoyed about this area is obviously the community and really the interaction and being a part of that, whereas you get into some larger metro areas and you lose that.
Right. Krista, when it comes to your job of working in the community and reaching out to folks, I mean, do you get a lot more flexibility, I suppose, as to maybe what you can do with local vendors and local businesses and how much you can get involved in the community?
Yeah, absolutely. We have been involved in everything from job fairs at the college here to the healthcare coalitions.
You're here as part of CHIC this morning,
exactly.
So the Health Improvement Council.
Exactly. And we're part of the chamber, and some of our staff is actually joining some of the subcommittees. Our chef and myself are going to be part of the special events committee. So it doesn't just reach into the healthcare community. We're really providing services and business for multiple different levels and layers.
And I imagine that's important too in smaller communities, because sometimes in a Las Vegas or even in Albuquerque, it's such a big area that can sometimes get lost. But in smaller communities, those things really mean a lot to the individuals in the community.
Absolutely. And the other thing that New Mexico is kind of a little unique to is we lose a lot of our patients to the Albuquerques, to the Las Vegas. Part of our mission is to reach out to those hospitals and bring our folks back. Let them rehab here in Farmington, where they're going to get visitors, they're going to be happier, which is going to speed the recovery up.
That's a really good point that I like to make all the time about having these facilities locally, so that folks, I mean, even if they're injured or hurt somewhere out of town, they can still at some point hopefully be transferred back closer to home to get some of those local visits and family, friends, and things like that, and being able to continue their recovery closer to home.
Yeah, I've received probably 4 or 5 phone calls in the past week. Individuals had family members in hospitals in Phoenix, Arizona, and they were looking for some rehabilitation closer. So what we've done is kind of help them and guide them and place them as close as possible to the Farmington area.
Right.
And then we'll follow up once we open our doors if they're still in need.
Sure. And this is all part of this growing area of healthcare, as we talked about before a little bit, about getting folks maybe out of a hospital room and into a facility like yours, ideally getting them home faster to save healthcare costs, because we all know how expensive that is these days, and also getting them home where they can maybe do heal faster, better, quicker, I suppose, in some cases, right?
Which is why we tend to think that our rehabilitation goes beyond our 4 walls. We will be, we've already met with some local home health care agencies, and we're starting a process that starts the discharge plan and the planning and the safety long before the guest even hits our building. We're looking at things like if a senior fell at home and had broken a hip, for example, they're in the hospital for 10 days. Then they're with us for 15 days for rehabilitation. Has anybody thought about the grocery situation at home or how they're going to get their medication? So we're talking as collaborating with our chef and with the home health care agencies, even thinking about outside the box about bringing or sending meals home for 48 hours until somebody can actually get to the grocery store and get appropriate food, making sure the medications don't interact with each other in a bad way when they get home, or they're taking the right medications, which is a huge problem. Our goal is to keep those folks out of the ER and the urgent care as much as possible.
Right. And this is a whole new kind of concept when it comes to rehabilitation care, is it not? Maybe different in the last, I don't know what you'd say, 5 years, 10 years? I mean, how new is this kind of concept of trying to look at the patient, the client, the guest, and help them transition from your facility back home, but still give them support once they're outside your doors?
I think that is a unique concept that we're actually trying to fine-tune. There's a lot of changes in the Medicare system particularly, and people are focusing on that, keeping folks out of the hospital. I just recently had gotten some statistics, from CMS, and they were saying that 61% of all Medicare payees had been fined in the state of New Mexico. So again, that is eventually going to be a snowball effect where you're going to see healthcare industry pulling out of certain areas. So working with your local home health care agencies, working with your local hospitals to get on board and having that open communication, that's what's going to be the key.
Sure. And certainly we see our population, those baby boomers aren't getting any younger, and so we are going to fall and break hips and have other issues that require services like the ones that you describe at your facility, right?
Absolutely. And we're going to have an atmosphere where it's conducive to us baby boomers. You know, a private room, a private bathroom. We will not have long-term care in the building. It's strictly short-term care. And the thought of when you're in the hospital and somebody comes to you and says, you have to go to a skilled nursing facility for rehab, the first thought is, I'm going to a nursing home. Well, that's why we're not really, although our license is skilled nursing facility, we are truly transitional rehab.
You're not set up for that longer term stay.
No.
From the beginning. And so what would you say the average stay would be? Would it be maybe a week or two? Is that even pushing it?
Yeah, I mean, it's really going to vary. I mean, each person will be different, but average is probably, if you look at it, is anywhere from 2 to 3 weeks, most likely. Some will be, shorter than that, and some will be longer, but that is a pretty good average. And I think that's, in healthcare, obviously CMS and Medicare, that's a big focus these days, is just, shortening those stays and saving costs in a certain sense, but at the same time also making sure that you have partnerships, as Krista's been talking about, with home health agencies and different things like that, so when they transition home that it is successful, and that you don't get those bounce backs to the hospital and different things like that, or the higher level of costs.
My guest this morning from Wellbrook Transitional Rehabilitation Facility will be opening their doors here in Farmington later on this spring. We're going to take a short break. When we come back, more with my guests in just a moment here on KSJE. The time right now is 8:30.
Today, yet another plan to save the media with technology. From American Public Media, this is Marketplace Tech, demystifying the digital economy. I'm Molly Wood.
Marketplace Tech is supported by Home Advisor, matching homeowners with home improvement professionals for a variety of home projects, from repairs to remodels. Homeowners can read reviews and book appointments online at homeadvisor.com. And by Rice University, working to achieve transformative discoveries and developing leaders who dare to disrupt conventional paradigms. Rice University, unconventional wisdom. More at rice.edu/future.
In the last week alone, digital media outlets have laid off hundreds of people. The publishers of USA Today are fighting off a takeover attempt from a hedge fund. The Washington Post actually ran a Super Bowl ad about how important journalism is. But subscriptions don't make enough money, and ads are annoying, data-sucking, and don't even work most